Good morning, everyone. A warm welcome to the interactive session on the occasion of National Dentist Day on the topic of teeth, gums, and beyond. How oral care affects the overall health. So, every year on March 6th marks the National Dentist Day in India. This day serves as a reminder for the people to maintain good oral hygiene. Dentist plays an important role in keeping our mouths healthy. So, it's a perfect occasion to show gratefulness. So, this National Day also serves as a reminder to get frequent health checkups of your dental checkups also and to properly brush and floss our teeth. Moreover, from raising awareness of the risk of the poor oral health to expert dental care from of the tips for the kids to elderly. Here's everything you need to know. So here's a warm welcome for our estimated speaker, Dr. Vipin Dehane, sir. Good morning, sir.
Hi, good morning. Yeah.
Dr. Vipin Dehane sir is our consultant oral and maxillofacial surgeon and implantologist, and also is the head of the department of the dentistry and osteum implants course director. So, sir, let's begin our session.
Hi, good morning. Warm welcome to all the audience from SL Raheja Hospital. Today is the Happy Dentist Day. So I welcome you all on the this occasion. This is a small gesture for all health workers who is working in the dentistry. So today's theme is oral hygiene and hygiene and hygiene. So we have to maintain our oral hygiene as per guidelines given by our dentist. So if you have to maintain our oral hygiene, you have to always go for a regular dental checkup. Also, you have to do always prophylactic scaling. And most of the systemic diseases are related to dental oral hygiene.
Sir, let's begin with our session with the questionnaire. So, does oral health impact the overall systemic health?
Yeah, see, oral health, if you find most of the bacteria, if you calculate the whole world bacteria, 30% of bacteria is in the oral mouth, oral cavity. That is for sure. So if you have to maintain the balance ratio of the harmful bacteria as well as the useful bacteria, you have to maintain the oral flora of the oral cavity. This all flora is maintained by the pH level, which is in the oral cavity. That pH level is maintained by your saliva and other ingredients in the cavity. But this, if you have a harmful bacteria, that pH will get destroyed and you will get a caries and the periodontal health issues. So you have to maintain this oral flora with proper brushing and regular checkup to the dentist. I advise every 6 months there should be a proper prophylactic uh, health checkups or the dental checkup from your dentist.
Wow, that was interesting to know about these how oral health impacts the systemic health. Well, in your opinion, can poor health contributes to the development of the diabetes?
Yeah, there is something called as periodontal health related to diabetes. Whenever you have a gum diseases, it's increase your glucose level. So directly or indirectly, when your glucose level get increased, it's a form of diabetic level. Also, when you have a diabetes or when you have a high sugar level, it's more prone for periodontal health disease. So if the patient is having a diabetes, it should always go for a prophylactic scaling every 6 to 8 months. Also, there are proper brushing techniques for such patients because the periodontal health is very poor in such cases. So every diabetic patient should go for a dental health checkup. And there is something called as post diabetic evaluation. So if you have a detected with the diabetes, there is particular periodontal score. It should be matched for every patient. So that score will decide what type of periodontal grade you are having. So it's always mandatory to have a checkup for the dental for the diabetic patients.
So, in diabetic patient, can we do the dental treatments?
Yeah, there is no contraindication for dental treatments in the diabetic patients. Even if the patient is diabetic, he or she always should go for an dental checkups or dental treatment. Dental treatment is mandatory for such patients because they are more prone for periodontal diseases like gingivitis, periodontitis, that is chronic periodontitis, frequent abscess in the oral cavity. There might be some cause of foul smelling in the oral cavity, This all are due to diabetic level increase in the sugar level, which attract more bacteria in that area, or particular strains of bacteria are there which are more prone in the oral cavity in diabetic patient. So you have to get rid of all such diabetic bacteria which are present in the oral cavities. Yeah.
Well, can the dental treatment be safely performed in blood pressure patients or the heart patients?
There is no contraindicate for hypertensive patients for undergoing dental treatment. Any dental treatment like scaling, polishing, root canal, extraction can be done with proper doses of your drugs which you are taking. If you are taking antiplatelets or blood thinners, जो बोलते हैं ना खून पतला होने की दवाई, so you have to stop that medicines 3 to 5 days prior to your procedure. So there is no contraindication, but make sure that when you are going for a dental checkup, your blood pressure should be with the optimum level. It should not be on the higher side. If you have a higher side, get controlled with your medicines what you are taking, and then go for a dental treatment. It's very safe. आपका dental treatment काफी safe है in hypertensive patient. There is no contraindication for cardiac patients. But you have to maintain the proper sterilizations, and you should always go for a prophylactic antibiotics for such cases.
We would also like to know, can the bleeding gums increase the risk of developing the blood pressure or heart disease and vice versa?
Yeah. Whenever you have a bleeding gums, it's all because of periodontal detachment or inflammation in the gums. This causes something called as bacteremia. Whenever there is a bacteremia means there is a bacteria in the blood. So whenever you have a bacteremia cases, or when you find a bacteria in the blood, it may travel to the various part of the body, so which causes frequent infections to the oral body. So, in order to take care for that, you should always go for an regular scaling and the prophylactics root planning or the gum planning. That is called as periodontal flap surgeries for such cases. Any bleeding in the oral cavity or any bleeding in the gums is always mandatory to go for an treatment for it.
Well, it's remarkable to know how dental treatments can be safely performed in medically compromised patients. So, is it really true that poor dental health affects the pregnancy and the birth of baby?
Whenever your patient is pregnant, there is an increase in the hormonal level. Whenever mainly the prostaglandins levels are increased in such cases. Also the quite amount of estrogens. So this called detachment of periodontal ligaments, or we call it as the gum tissues in the oral cavity. Or this will cause the derangement in the various parameters present in the oral flora. So every pregnant woman should go for an complete prophylactic in the before going for pregnancy or the safe period. That is the second and fourth trimester always safe. So go for a dental or checkup in second and fourth trimester so that there should not be any harm to the baby. There are various studies where we find that the poor oral hygiene patient will having ill effects on the child, like weight loss, some chronic diseases. So always mandatory for a pregnant patient to have an dental prophylaxis or dental check.
So, this shows that it should be have more awareness of the pre-dental and prenatal dental checkups for the mothers should be encouraged for the safer and smoother pregnancy. And also, I feel like there should be also an awareness regarding for the first in the first month of baby. Also, there should be an dental checkups to know the awareness regarding the oral hygiene for the babies of the initial months. So next, see that how the are the dental checkups or the dental fitness advised before undergoing any medical surgery?
There are various parameters where you need an dental fitness for that, starting from the cataract to the any procedures in the leg. For every procedure, there should be a dental fitness because I had already informed there is something term called as bacteremia. So whenever there is a bleeding gums or whenever there is a bacteria infection in the oral cavity, with the blood stream it will go from the head to the toe. So you always have a dental checkup for every cases which are going for an any procedures. Number one. Number two, various conditions, various conditions like when you are going for an radiations. So dental treatment are always contraindicated in such cases. You can't do any major procedures like extractions and all. So whenever patient is going for chemotherapy or radiation, they always go for removal of the infected tooth or any abscesses or any prophylaxis scaling or periodontal flap surgery should be done. So for such cases जहाँ हमको लगता है कि पेशेंट्स को मेजर ट्रीटमेंट शुरू करना है, जैसे ट्रीटमेंट करना है या फिर कोई रूमेटॉइड आर्थराइटिस के लिए कोई ड्रग बिस्फॉस्फोनेट शुरू करना है, तो इन सब कंडीशंस में पहले जाके पेशेंट्स का ओरल प्रोफिलैक्सिस करके पूरा इवैल्यूएशन करना चाहिए कि डेंटल केरीज है क्या, या आपकी केरीज अगर डीप नहीं है, ज़्यादा पल्प तक के नहीं है, तो यू हैव टू डायरेक्टली गो फॉर ए फिलिंग इन दैट केस. इफ डीप है तो गो फॉर ए रूट कैनल एंड कैपिंग फॉर दैट केस टू प्रिवेंट दैट टीथ. अगर बैडली डिस्ट्रक्टेड टीथ है, यस,
So, it is really informative to know why dental
badly
fitness.
badly badly distracted teeth है आपका, तो then you go for an extraction or any other preventive measures. If अगर आपके इसमें gum problems है, तो if there is bleeding gums or pockets है, तो in that case always go for a thorough flap surgery with lasers or with the conventional blade. एंड लास्ट पॉइंट, अगर आपके कैविटी में या आपके ओरल फ्लोरा में या आपके टीथ में कहीं पे भी आपको लगता है कि कुछ कैलकुलस या फूड पार्टिकल डिपॉजिट्स है, तो ट्राई टू रिमूव इन सच केसेस एज अर्ली एज पॉसिबल, बिकॉज एनी फूड इन द ओरल कैविटी फॉर 24 hours will get fermented and it will superimpose with the bacteria or the various other microbes in that area. तो एक दिन अगर खाना अगर सड़ता है, so that will create and various bacteria in the home also. So same cause with the oral cavity also. So always keep your oral cavity clean. That's why the theme of this year for 2025 in the on the National Dentist Day is the just to clean your oral cavity. It's a benchmark that if you clean your oral cavity, your health will be good or your health will be fine. Yes.
Well, we would like to also know, can poor dental health and smoking, consumption of tobacco lead to oral cancer?
Yeah. First of all, 80% of the cancer of the head and neck area, it's all because of tobacco chewing or tobacco smoking. So it's always mandatory to quit tobacco. If you want to get the rid from the head and neck cancer, always get rid from the tobacco. This is from continuous last from 20-25 years. Every dentist is telling, but this should be awareness towards the patients, your patients which are coming to the hospital or the dental OPDs. You should always educate the patient not to have a smoking or not to have a dental, not to have a tobacco. This tobacco or any forms of smoking has an carcinogenic effects or the carcinogenic drugs which are present in the uh, in the tobacco, which will cause innumerous burning sensations in the oral cavity, which leads to the undifferentiated cell, which leading to the cancers or the precancerous condition. Even in a small betel nut chewing, continuous betel nut chewing can cause an oral submucous fibrosis, which is again a precancerous condition. So whatever you are eating, whatever you are consuming, you should not make it an habit. Like any type of betel nut, any type of chewing tobacco. लोग काफी पेशेंट्स का एक ही रहता है, सर हम तंबाकू नहीं खाते थे फिर हमको कैंसर हो गया. It's not about the tobacco which you are eating. It's about the pan parag or what type of betel nut you are chewing. Betel nut, any type of rajnigandha, this all can contribute to oral submucous fibrosis, which is again a pre-malignant condition that may lead up into cancer. So initially pre-malignant condition and the cancer doesn't have any difference. It always harms your oral cavity. ओरल फाइब्रोसिस में आपका माउथ ओपनिंग हार्डली 2 फिंगर रहता है, 1 फिंगर रहता है, जिससे आप खाना भी नहीं खा सकते. So it's very difficult. One of the most critical surgeries head and neck oncosurgeons find is oral submucous resection and the cancer treatment. आपको एक बार का कैंसर हो गया तो it's very difficult to get to the normal life. So better to quit the tobacco and the smoking as early as possible. Don't make it a habit. If any habit in the oral cavity will lead to malignancy or cancerous conditions. That is the main thing what you have to get educated in your head. When you are smoking, when you are chewing tobacco, make sure that you will on one fine day you will land up with some of the oral cavity diseases. It's not about the cancer what you are getting. It's about the burning sensation will cause degeneration of the epithelial layer of the oral cavity, which is causing uh, fibrosis and other conditions like reducing the mouth opening, halitosis, uh, difficulty in speech, difficulty in swallowing, this all because of burning sensations what you cause in the oral cavity. And last point regarding the smoking and tobacco, it's not mandatory to have a tobacco or the smoking because it kills your life. So that should be always in your mind when you think about such consumptions of tobacco and smoking. Also, yeah, also if you consume some alcohol with it, and so it will act as a synergic effect for that. So smoke any smoking any type of alcohol is dangerous for oral cavity. Again, it's called burning sensations.
Well, it was really informative message sessions regarding the stoppage of the tobacco and also to how to avoid the risk of the cancer. So, well, can the root canal treatments and the tooth extraction can be safely performed in the medical compromised patients?
Any of the medically compromised patient can undergo root canal. It's one of the safest procedure. It's one of the safest procedure in life and the teeth saving procedure. It's not contraindicated. None of the root canal is contraindicated for any of the patient of the medically compromised cases. But you should have a proper sterilization, proper roll of instruments, and proper closing, that is obturation. So we are just mimicking the like mimic like. We are just removing the infected pulp and replacing it with the gutta percha of the rubbery material. So it just we are inserting some inert material in the tooth cavity. That's all. And for protection, we are making a capping on it. So root canal is not contraindicated for any of the procedures of in the medically compromised cases. But in case of extractions, you have to see what type of bone disease or what type of diseases patient is having. If patient is having is consuming various bisphosphonates, you have to delay your extractions for 6 months to 1 year, depending on doses what they are taking. In case of patients we having rheumatoid arthritis, you have to do a proper curettage and the closure, flap closure of your extraction socket. If you go for a good extraction with sterilization and proper closure of your oral mucosa, there will not be any infection. Don't worry. So it's not contraindicated for an extraction of the root canal in case of any medically compromised cases. But the thumb rule is that whenever you get a medically compromised cases, you have to have a number one thorough case history. Case history is always mandatory. What type of diseases patient is having, what type of immunocompromised case status is that, what type of medicine patient is taking, and last, what type of medical status or the health status of that patient is having. Suppose, for example, patient is hypertensive and gone for some and most common cause for CABG. So in that case, check whether the patient is on antiplatelets or anticoagulative agents. So you have to stop that agents prior to doing an extraction. For root canal treatment, it's not mandatory to stop an antiplatelets or anticoagulative agents. For extraction of the tooth, any invasive procedure in the oral cavity, you have to stop such drugs. Number two, इफ द पेशेंट इज हाइपरटेंसिव एंड जिनका बीपी बढ़ा हुआ रहता है, तो वो केस में वी हैव टू add some anti-hypertensive additional drug for few days so that your BP should be in the or the blood pressure should be in the optimum level, and you can go for any extraction or the root canal treatment. There are various local anesthesia or the pain management therapies for such medically compromised cases where you use bupivacaine along with combination with the lignocaine with or without adrenaline. Nowadays, we can use urticane or bupivacaine in case of patient with cardiac disease. Most often, we are for the cardiac patient, we advise to have a ropivacaine. It's one of the good molecule for cardiac patients, which will not increase the heart rate of the patient. Now we are going for then medically compromised patients who are having a bone diseases. So evaluate what type of bone disease the patient is having, what type of healing the patient is having. Go for a small procedures that mobile extractions, and then go for a major cases in such cases. So any case with the proper antiseptic or the sterilization, you can go for extractions or root canal treatment.
Also, we would like to know that dental implants can be safely performed in same medically compromised patients.
See, dental implants is one of the booming branch in the dentistry. It is the third dentition, what we call as. It's a fixed teeth. What a dental implant is just a fixed teeth. It's a titanium part which is fixed in the oral cavity or the bony part, that is maxilla or mandible, and on that the suprastructure, that is crown, is placed. So it's a titanium bio-inert material. That is biocompatible bio-inert. So that titanium material get inserted in the bone and get osteointegrated. That means fused with your jaw cavity or the bone line. So I think there is no um, effect of any other things in the medical compromise cases. But you should know what type of healing the patient is having. So there is no absolute contraindication for the dental implants. But when you are planning for a dental implants, in case of medically compromised cases, you have to make sure that your oral status or the periodontal disease should patient should be free from the periodontal disease, and patient and the in case of diabetic patient, the HbA1c should be below 8%. And last point, for every medically compromised cases, you should have a fitness from the physician. That is always mandatory to go for dental implants.
Wow, that was really amazing to know that how the dental implants can be safely placed in all the patients. So, let us know now regarding the latest advances that will help in betterment outcomes and benefits of the patients in dentistry.
Dentistry is evolving branch. It starts from 1960s. Just, our forefathers were having a dentistry. It's now what we are practicing in 2025 is totally different from what practicing in 1960s or 1970s. it's an evolution of dental practice what is going on. जब dental practice शुरू हुआ था वो time पे there were no advances. There were just a small drills and manual drills which were used, and the only option was just a removal of the teeth or some fillings. That's all. That was in the 1960s 70s going on. Once the advances in the technology has updated, it had been replaced with the various kind of drills and the root canals treatments. Root canal was started in the 1985 to 90s. Now it is one of the prime important for the tooth saving. So root canal is one of the thing which advanced in the dental fraternity. Number two, there are various types of tooth color composites or the tooth color filling materials that have been advanced. And number three, there are various types of machineries which is getting replaced with the ordinary machines. For example, root canal was done with the hand files. Nowadays, it is done with the rotary instrument. That is the newer techniques. So you can complete your root canal treatment within a fraction of 1 hour. Complete root canal can be done with crown cutting within a fraction of 1 hour. So nowadays, you don't need 2 to 3 setting unless your tooth is infected. If it's slightly infected or it's just an pulpitis, you can directly go for a single visit or single visit root canal treatment. Number two, if you want to make a crown, we'll go step by step. If you want to make a crown over the root canal treatment, it's a daycare procedure. Now, with the increase in the advance in the technology of CAD CAM, we can make a customized crown, digitally customized crown within a fraction of 2 hours in the lab. So nowadays we have a scanners now, so no need of conventional impressions. You can directly scan the oral cavity, send it to lab. Within a fraction of 2 to 3 hours, you'll get a ready-made crown. So it's now a one-day dentistry. You can just go for a root canal cutting with a local anesthesia, and directly within a 2 hours, we can get a crown. So the procedure which were taking 10 to 15 days, now it is completed in the window because of the advanced technology. This is regarding the root canal and the capping. Then we go for a filling materials. There are advanced filling material which is tooth color. So even if we can go for a restoration of blackish teeth with a white teeth, which we can't appreciate in the oral cavity, that filling has been done. So various nanoparticles or the hybrid particles has been launched from last 10 to 15 years, where you can get a tooth colored restoration to develop a particular smile of the patient. And when you go for now surgical aspects, there are various drills has been advanced. The drills, conventional drills has been replaced with the piezo surgery unit. It's an ultrasonic machine where you can do bone cutting without hammering or without any causing issues with your bony particles or the bony structures of the oral cavity. So tooth extraction has been made easy without damaging most of the bone structures. So piezo surgery is one of the advancement. The patient is having a bleeding issues or having an of various periodontal disease, you can use an lasers for that. Nowadays in India, we have a various frequencies of nano 910 to 680, sorry 880 frequency of nano hybrid or the nano mm, lasers, that is called as diode lasers, which can be used safely in the oral cavity to eliminate the periodontitis chronic infections. So lasers can be used. We are using it in our hospitals from last 10 years. It's very safe procedures and non-invasive in case of medically compromised patients. So what I feel, any dental pockets or any periodontal pocket should be get treated uh, with your lasers. It's a small procedure. You have to apply. You don't have to give anesthesia also. Just you have to apply some drops of uh, Lalocan jelly, and you can use and lasers for a disinfect. It's a routine procedure in the dental setup. So laser is one of the advancement. We also, then we have in various types of implants nowadays. In case of medically compromised cases, we had launch with this of companies that launch with an CA implant, it's calcium chloride. Your normal titanium implant will get dripped into some solutions called as calcium chloride, hydroxyapatite. These solutions will cause increase in the osseointegration or the bone fusion with the implant. That is most important. How the implant will get fused with the bone. So this will increase the intensity of bone implant fusion. That is called osseointegration. So before this CA implants or before this technology, we have to wait for 3 to 4 months to get osteointegrated. Now your implant will get osteointegrated within a fraction of 1.5 months to 2 months. So early osteointegration will take care with the help of CA implants or some calcium chloride or some hydroxyapatite layering implants. And last point, chair, dental chairs. Now we have a high-tech dental chair. So everything is on the digital chairs. So you can do X-rays, dental X-rays on the dental chairs with the RVGs. So everything is high tech now. So if you sit on the dental chairs, most of the X-ray, digital X-rays, fillings, root canals, surgeries can be done in a single setting. We have few international patients where we do procedures within a fraction of 2 days. Complete dental treatment with crowns, with extractions, implants we do in the procedures of 2 days. So this high-tech dental technology is available at our centers. Yeah. Anything more you want to ask about? You
Well,
have to sneer about the advanced in the dentistry.
yeah. Well, it was really captivating to know there are so many advanced dental technologies which are available, which help in more faster, precise, and comfortable dental treatment for the patients. So, sir, what is a key takeaway message for all the viewers?
तो देखिए सबसे पहले आपको ओरल हाइजीन मेंटेन करना है इट्स नॉट अबाउट डेंटिस्ट जॉब टू क्लीन एवरीथिंग फ्रॉम द ओरल कैविटी इट्स फर्स्ट ऑफ ऑल इट्स अ जॉब ऑफ पेशेंट टू क्लीन हिज ओरल कैविटी तो सबसे पहले आपको 2 बार कंटिन्यूस ब्रश करना है विद प्रॉपर टेक्निक्स नंबर 2 any medically compromised cases patient is there any so you have to always go for an routine dental checkups to your dentist and number 3 any gums disease or any bleeding in the oral cavity, any halitosis is a dangerous sign for post-dental bacteremia. So this all should be safeguarded with the proper checkups. And last, we had invented one of more technique is the ozone layer technique. So we are with prophylactic checkup, we do some ozone layer techniques on the patient so that it will increase the nascent oxygen in that area so that it will cause the healing in the periodontal ligaments or the periodontal tissues. This is one of the techniques we are using nowadays along with the diagnosis. And last key point is if you maintain your oral cavity, if you maintain your oral hygiene, you will maintain your health. That's all. It's a routine part of your body. So you have to always maintain. Any extraction or any missing teeth is a disability for your body. So if you don't want to have a disability, you have to prevent your teeth. It's as good as preventing your hand, legs, eyes. So every teeth should be prevented except your wisdom tooth. That should be removed mandatory at the age of adolescence. Yes, Neil.
Thank you, sir, for such an enlightening session. We truly appreciate your valuable insights. Thank you, viewers, for joining us today. Have a great day. Thank you so much, sir.
Thank you, Sneha. Thank you. And I hope this lecture was informative for all of you. And on this Happy Dentist Day, it's a small gesture to all the dentists, but it's a small gesture to all the patients who are going for a dental treatment. We appreciate all the patients should go for a treatment so that it will maintain your health of your health and it will maintain your body good. Thank you. Thank you, Sneha.